Hospitals across the nation are reaching their breaking points as the coronavirus pandemic shows no signs of slowing down. Infections continue to rise at alarming rates. For the first time, the U.S. has now reported more than 19,000 deaths from the virus in a single week. COVID-19 has now killed more than 325,000 people nationwide since the start of the pandemic. More than 18.4 million cases have been confirmed. Despite warnings from the CDC to stay at home, many people are still traveling for the holidays. The Transportation Security Administration says it's screened millions of passengers over the last few days as fears mount that the travel and large family gatherings for Christmas could lead to an even bigger spike in infections. In the meantime, the U.S. government says it's purchasing another 100 million doses of Pfizer's vaccine. That would end up doubling the nation's supply of that vaccine as officials work to get as many Americans the shot as possible. Lilia Luciano has more on this story.
Critically ill patients spilling into hallways, ICUs completely full. That's how bad it's gotten in California. In Los Angeles County, hospitals admitted less than 150 COVID patients a day in October. By Thanksgiving, it was 300, and now 700 a day and getting worse. Among those answering the call for help, traveling nurse Sarah Howes from Washington, D.C., who has filled in across the country, including in hard-hit El Paso.
It's pretty gruesome, and it's like slow-motion trauma.
This week, she began work in California, which took more than 9 months to reach 1 million COVID cases. Just 6 weeks later, the state about to hit 2 million, and deaths are skyrocketing.
I see the implications, and my patients are dying alone.
How has your job changed?
My job, traditionally as a cardiac ICU nurse, was to fix people and get them better. And my job now is to put my patients in body bags and get the room ready for the next patient.
The hope is that help keeps coming. The U.S. government has reached an agreement with Pfizer for 100 million more doses of vaccine. New York's mayor today ordering law enforcement to keep tabs on those now in quarantine after flying from the United Kingdom.
We are going to have sheriff's deputies go to the home or the hotel of every single traveler coming in from the UK.
And yet, there are still the maskless gatherings, like this conga line in New York, where people are either oblivious to the ongoing pandemic or outright defiant.
Tonight, I'm going to share something else.
Actor Kirk Cameron last night leading a group of carolers in Southern California, a sing-along in one of the nation's worst hotspots.
My fear is that people aren't taking care of themselves, especially during this time where people really want to get together. I'm not going to quit on our community, and I hope that the communities aren't going to quit on us.
California health officials are desperate to enlist more Sarahs, 3,000 more to be exact, but they're just nowhere to be found. Lana?
Oh, wow, Lilia, thank you. When the vaccine is made available to more of the public, the question remains, how many people will actually take it? CBS News chief medical correspondent Dr. Jon LaPook has more on how advocates are addressing skepticism surrounding the shot and assuring Americans that it is in fact safe to take.
Armed with facts, community health deputies are hitting the streets of Pittsburgh to boost confidence in the new COVID vaccines.
The Moderna vaccine was created by an African-American woman.
Did not know that.
Yeah, I know. That's on the download. We don't hear about that.
Using well-known locals to promote taking a shot.
So you know Mike, so you can trust his opinion, right?
Like former Pittsburgh Steeler Mike Logan, who was sick with COVID back in June.
It actually changed my mind on how I felt about the vaccine. I would come out here and share my testimony with my community. My community hasn't always been trusting of things that are going on in the medical field.
It's part of the Neighborhood Resilience Project founded by Father Paul Abernethy. He says decades of healthcare inequity have led to mistrust.
We have to be honest about the way in which government systems have failed these communities time and time again. And so whenever people see the government involved in the dissemination or the development of these vaccines, there's a skepticism in the context of that history.
And there's skepticism about the record pace of the rollout.
It's great that it's fast, it's warp speed, but has it been done right?
Though the vaccines have been developed quickly, the science behind them was developed over decades. In 2003, it took 20 months to go from identifying the genetic makeup of a virus to starting a human vaccine trial. This year, just 2 months. Amy Pisane runs the advocacy group Vaccinate Your Family. She says there were no shortcuts on safety.
We watched and made sure that the FDA and the CDC followed the proper protocols, and we demanded that it be such.
As a practicing physician here at NYU Langone Health, I was next up today to get the Pfizer vaccine, and I was surprised by how emotional I got afterwards, tearing up. It was a moment of relief after months of tension so many of us have been feeling. And it made me realize that even though there's still a lot of work to do, now is a moment to stop and appreciate what an astounding scientific achievement it's been to have these vaccines available in less than a year. Truly remarkable, Lana.
Wow, Dr. LaPook, so powerful to hear you talk about that. All right, I am joined now by Dr. Robert Glatter. He is an emergency physician at Lenox Hill Hospital in New York City. Dr. Glatter, thanks for being with us. With 2 vaccines now being distributed, one question that many people have is when can things start returning to normal? Dr. Anthony Fauci addressed this earlier in an interview with my colleague, Anne-Marie Green. First, I want to play some of that sound for our viewers.
We hope that as we get into the first quarter and the second quarter of 2021, that we'll have enough vaccine doses to be able to vaccinate a substantial proportion of the population by the end of the second quarter as we get into the summer of 2021, so that by the time we're at the end of the summer, if we can get the overwhelming majority of the people in this country to accept vaccinations, I think we'll be in very good shape towards literally approaching what all of us would want, is a return to some form of normality.
And that is what we are all obviously looking for, that return to normality, Dr. Glatter. So if you could remind our viewers, what percentage of Americans need to be vaccinated before we can actually achieve herd immunity and get back to normal?
Right, and that's a great question. In order to achieve this herd immunity, we need to be at a very high level of vaccination. We're talking about 75 to 85% of the population. If we only achieve 40 to 50%, we're not going to make it. So it's so imperative that we talk to people at the community level. Just as your prior segment really alluded to, we have to engage influencers, people that on the community level can talk to people and convince them that this is a safe vaccine. While it's been through a very short period of time in terms of development, the science is really backed up. And in terms of how we did it, it's because there's been about a decade of research that went into it. The science is sound, and it's not going to affect your DNA. It does not go into the nucleus of your cell. It basically, this vaccine, the mRNA vaccine, teaches your cells how to produce proteins in order to fight the virus. And so this technology is novel, and we need to embrace it.
Really remarkable technology, and yet because it is so cutting edge, there are a lot of people who say that they are hesitant to receive the vaccine. I know doctors like you are coming on shows like mine to help combat misinformation and to assure patients that this vaccine is safe to take. One of the interesting things is how the polio vaccine sort of mirrors what we're experiencing right now, and how in 1956 Elvis, backstage at the Ed Sullivan Show, got the vaccine, and how that completely changed how Americans really felt about it. I wonder if you think that there is a role for pop culture, for singers or movie stars to play in trying to get this vaccine accepted by people in this country who might be skeptical.
Absolutely. I think we have to get the people who we look to, whether it's people on social media, daily people who sing, people who are entertainers. We're talking about people that influence people. But ultimately, we're hoping that at the community level, we're looking at people, in churches and synagogues, barbershops, people, who are really influenced at a local level that can spread the word, and trying to educate these types of people, get them vaccinated, and get them to embrace the principles behind the new vaccine so that they can tell people in their communities that it is safe. We need all hands on deck here. We're talking about a significant effort that in order to get this herd immunity, we're looking at 75 to 80%. And we really need to get there. We're hoping to do it, as Dr. Fauci says, by the end of 2021. But it could even take longer. I mean, that's the reality behind this. We really need to dispel all the myths behind this vaccination and really concentrate and focus on science, because this is what it's all about. This is about the lives of people and getting back to normal. We so much want to be there, and it's very imperative that we do.
Well, I want to ask you, Dr. Glatter, a little bit more about this new coronavirus strain that is spreading right now in the UK. Health experts say that it seems to infect people more easily. Is there any chance that this strain of the virus could render our current vaccine less effective? And I do want to say that though it seems like it's more easily spread, it does not seem to be more deadly or more dangerous necessarily at this point.
That's right. We don't have all the data yet, and the studies haven't been fully done. But from what we know about how the vaccine works and what it's intended to do, there's no indication right now that this variant strain or strains that we're seeing in the UK and South Africa would have any really detriment in terms of vaccination. And certainly we need to do more experiments and more scientific work to back this up. But we do know that the vaccine really should work. It's unlikely that these strains would detrimentally affect the actual vaccination process. We know that these types of viruses mutate all the time in nature. It's not uncommon. We expect that. And this really is built into the process of making the vaccine, the idea that there could be certain variants or mutations. So I think people need to understand that.
Well, you may have heard before, despite the CDC warnings to stay at home, the TSA has screened more than 3 million travelers from Friday through Sunday. What's your advice to people who still plan to travel this holiday? Is there a way besides staying at home that they can reduce their risk of infection if they simply won't heed these CDC warnings?
Right. I think, what you're saying, we need to be really impressive on people not to travel. And that's really the important thing. We don't need to, expose people unnecessarily to the risks of travel, especially in the terminal, in the airport lounges. These are really problematic areas where you could pick up the virus. And obviously, it's so important if you do travel to make sure you wear a mask. You've got to stay your distance as best you can. You've got to wash your hands. You've got to do the tried and true measures that help prevent spread. And I want to reiterate that, virtual holidays, Thanksgiving, Christmas, Hanukkah, this is the way to go. We don't need to needlessly expose people to the virus. When people travel, the virus travels. And that's the most important thing to understand. We can really make a dent if we get this message across.
I heard somebody describe it as a down payment on future holidays. All right, Dr. Robert Glatter, thank you so much for joining us.
My pleasure.